Well, the Ford government announced yesterday that students will not be returning to classrooms this spring. He says experts couldn't guarantee that reopening schools wouldn't lead to new outbreaks of COVID-19, especially given how easily the variants of concern are transmitted. That decision might come as a surprise to many people who were expecting kids to be heading back to class. One of those people might be our medical officer of health for the Thunder Bay District, Dr. Janet DeMille. She joins me now for our weekly chat. Dr. DeMille, good morning.
Good morning, Amy.
So I don't know if you were surprised by that announcement, but I know you had talked about wanting kids to go back to class. What was your reaction to the decision not to reopen schools?
So I think I was a bit pessimistic anyway leading up to that based on what I had heard, so it didn't necessarily catch me off guard yesterday. I have to say, though, I was disappointed. I certainly have felt that it was okay to return to school from a public health perspective, and that it was important that there be a return to school at least for a few weeks. So it was disappointing to hear that, and yeah.
Why did you feel it was important for kids to return, even if just for a few weeks?
Because we know that there are a lot of harms that children are currently experiencing, and their families, and a lot of pressures, and school is very fundamental for the overall mental well-being and development and social development of children. And it's very clear that when it's done, like when it's not sort of that in-person kind of interaction, that they can be very much impacts. And we've heard it. We've heard it from people who, in organizations that provide services to children here, particularly mental health, heard it from teachers that, that it's hard to engage for many kids in online learning. That there are kids that are sort of being lost, that are disengaged. And it's also, I had a thought and I can't remember. But anyway, we know that the harms that are happening, and I've heard, and even from, primary care practitioners and others, of some of the implications that the closure, and of course the closure here in Thunder Bay schools has been since March 1st, so it's been even longer than most other schools across the province have experienced.
Well, did you feel heard? Because health officials were asked to provide their input to the government.
Oh, I do feel heard, and I did provide input, and certainly on the public health side, there was meetings that we had, for example, with the Ministry of Health and the Office of the Chief Medical Officer of Health. So, and I did respond to that letter from last week from the Premier. But I do recognize that the Premier and the Cabinet do have to consider, the larger picture, and they have to consider it for all of Ontario. And whereas I'm very focused, obviously, on Thunder Bay District and more broadly perhaps in Northern Ontario or Northwestern Ontario, and so certainly would have appreciated even a regional approach to managing schools. But I do realize that the government has to consider the broader context. And the truth is, we are still, this is still a pandemic. We still have COVID here. It's not like we're out of the woods, where we need to recognize that COVID is still with us. And then, when you reopen schools, it's not a no-risk situation, and it was never going to be. But it was on the balance of the risks and the benefits. I certainly felt that it would be, there was value in the return to school.
When we're talking about a regional approach, are you feeling at this point like that is pretty much off the table in terms of how things are going to be approached at this point?
At least at this point, I think it's the province is not considering a regional approach, and that is one way that they can choose to do it. I think we've generally done better than other parts of the province. I mean, we did have our own issues, certainly here in Thunder Bay in the last 6 months, which were very significant. But even when I look at where we are right now, what we're doing and how we've navigated, I think we do better. But I think that we are impacted by what happens in other jurisdictions, including the rest of Ontario. And there is, and I mentioned, we're obviously still in a pandemic and we still have COVID. And there's, ongoing issues with variants of concerns, and particularly, the what's now called the Delta variant. We do need to watch that and recognize the implications of that, and that the implications could be here as well.
So I do want to talk about our case numbers in this district as well. So one of the most significant cluster of cases in the district at this point is in the Greenstone area and the surrounding First Nations. Could you update us on the situation in that area?
So we have had, basically a cluster of cases, and this has been going on for the perhaps the last couple of weeks that we've been sort of managing. And honestly, it's one or two people, and then it spreads, of course, in households, and the same things that we've always seen, we're seeing happening. And so we're actively working with our partners to sort of track down where the spread is happening and to really contain the spread. And I think that's what we're really able to do. Unfortunately, this is largely driven by a variant, and it's a bit more infectious. And what we saw, I think, notably last week was a broader spread in one community, a First Nation community, and we are working with that community leadership and the work that they're doing, on the ground, along with our partners, and really have enhanced testing. So, when you do more testing and you do blitzes, you pick up, cases, and obviously putting together, all of those measures to be able to contain any ongoing spread while we support, individuals and households who do have, COVID there and that are recovering.
Can you tell me whether any of the people affected by that cluster of cases had received either one or both doses of a vaccine?
So I think we're still following up, and I don't have that is a question that we ask everybody, and I don't have the data. I'm understanding from everything that I've heard, though, is that it's felt that it's largely in people who may not have access to vaccine. We do know that there are many individuals who have had their 2 doses, and that it does not seem to be in that group. I do have to get sort of drill down on the data on that. We do know, though, that the vaccines and what we're seeing in our area and across the province and other jurisdictions is that vaccination works. And certainly 1 dose, especially after about 10 days to 2 weeks, we know that has very good effectiveness. It's better, of course, after 2, and so we're hoping everybody will get their second dose over the course of the summer. But and I think that's what we're also seeing in the cases that we have, that it's the vaccine is not generally in people who've been vaccinated.
So speaking of vaccinations, the health unit recently announced that it was launching some targeted vaccination clinics in a number of different neighborhoods in Thunder Bay. There will also be clinics for youth and for people in rural areas. Can you tell me more about those clinics and why you've decided to take that approach at this point?
So we've always done sort of targeted clinics into certain areas. I mean, we started this in February when we were sort of dealing with the surge and really wanting to get out there and protect the people that we felt were most at risk. And we actually, with our partners, have always continued, we have been doing that throughout. And this is really just an expansion. And we recognize, that there's a lot of people who are particularly keen, and we're, the clinic that we run at the Coliseum here in Thunder Bay is, we open up appointments, and there's always people who are taking those appointments. But for some people, whether it's vaccine hesitancy or less access, or it's not easy for them to go somewhere, maybe they have, concerns, maybe they have issues. There's always, that's always a part of any vaccination program, and we're really starting to look more as our numbers go up in terms of people accessing vaccination. We're starting to look more at how do we get people who may not have as easy access, or and making vaccine access very convenient to them, and sort of going out where people are, and and what we've done right now is sort of targeting particular neighborhoods, and then just inviting people to come to our clinic in those neighborhoods and get their first dose of vaccine if they haven't already received it.
And when you talk about barriers to access, what kind of barriers are you thinking about? Is it things perhaps like transportation?
You know what? It could be transportation. It could be time. If it could be that the people are doing, have been doing essential work, and so if they're, they can't necessarily take the time to get to a clinic. It might be, not an opportunity to talk to somebody about vaccination or be able to go and get one. It might be, proximity to their location. So we're just going to go and go out to, really looking at where people are at and make sure that they have access to vaccination and the opportunity to talk to somebody about vaccination and get it done, hopefully.
So just a few minutes left, Dr. DeMille, but I want to talk about a couple of specific vaccines. So we've been hearing some stories about shortages of the Moderna vaccine. Are you anticipating reduced supplies of Moderna?
The issue with Moderna is more that that the deliveries are less predictable than Pfizer, which we typically get on a weekly basis. The province is very confident, and the feds around that there's a large amount of Moderna coming into the country in the month of June. We just don't really have a concrete idea of the date and our allocation that we'll get from that, but they are confident. So we do know that there's a lot of people that will be wanting their second dose of Moderna, for example, and we do anticipate that it will be available. We did have to make some special clinics we didn't want to, have clinics for people expecting Moderna and then not be able to supply it just because of the uncertainty. But we are, everything we've heard we will be getting Moderna.
And for those who got AstraZeneca as their first shot, what is your, local recommendation in terms of what they can expect to get here, whether it's a second dose of AstraZeneca or whether it's the Pfizer or Moderna?
So I'm expecting that we will have the AstraZeneca to give everybody who received AstraZeneca as a first dose, if they want it for the second dose, that they will be able to get it. We do know that is coming for sure. And if people choose not to have the second dose of AstraZeneca, if they want Moderna or Pfizer, those mRNA vaccines, they will be able to get one of those. And certainly I would support either choice. I would reassure people that it is okay to get, though, the second dose of AstraZeneca, if that's what they want. That particular complication, VIT as it's called, is even more rare with the second dose, quite significantly, and so it's very safe for them to get the second dose of AstraZeneca.
All right, Dr. DeMille, we'll have to leave it there for this week, but as always, I very much appreciate your time and being a guest on the show. Thank you.
Thank you very much, Amy. Have a good day.
You too. Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District. And if you have a question for Dr. DeMille for our next conversation, you can email us at thunderbay@cbc.ca.